We have about 2 minutes. Currently in the room.
Mike Dellinger.
Leota is here. Nicole, Helen, Sean Rowland. And then online we have Mike Delger and Dwight Thompson. So we're still waiting for Commissioner Folkford.
Daryl Folkford.
There he is. And Robbie, but I'm not sure. Have you heard?
Haven't heard in response. No.
And JJ, I think is going to call.
Oh, and JJ too. Okay, good. So we still have 2 minutes before 1, so we'll just give it a minute here.
Hey, this is Robbie Sandberg joining you.
Okay.
Hi, Robbie.
Hello.
Okay.
JJ Connors. Thanks, JJ. Hello.
So, Commissioner Folkford, you have a full board now. On the phone, you have Dwight Thompson, yourself, Mike Delger, JJ Connor, Robbie Sandberg. And in the room, we have Leota Gormley. Did I say your name right? Okay, good.
All right, perfect. All right, looks like it's 1 o'clock. Let's go ahead and get started. Are you ready to go, Nicole?
I am ready. Yep, we are live.
Okay, all right, very good. I guess we'll open, has Sean called in yet?
Sean is present. I'm sorry. Sean Rowland is present in the room.
Oh, okay, and Teresa or Doc?
No, I have not heard from either of them, and they are not present.
Okay, all right, well, maybe they'll join us here in a moment. All right, I guess we will go ahead and get going. First thing on the, first thing is any public comment for anything related to the Board of Health.
I'm seeing nothing.
Nothing?
No,
Okay.
sir.
All right, we'll move on to our COVID-19 plans, and I guess Sean is the one that we're wanted to talk about. Was that the stroll?
Correct. The Christmas stroll is the only one that we've received, and I believe that Debbie is probably online or trying to join just to hear if there's any comments on it. I have not spent a lot of time looking at this based on the activities that we were doing for the courthouse over the last few days. So it may be something that we will have to just kind of discuss a little, but and then we can get the emails going back and forth. I know they have tried to come up with a plan that will accommodate and change kind of how it's been done in the past to meet kind of the idea of how we do things now with COVID-19.
And Debbie is present online.
Okay. From what you've read so far, or anybody else on the board, are there any suggestions for them at this point?
Yeah, I know that it would have been nicer if Debbie could have kind of walked us through it, and I know that I think we can always set up a conference call to do that separately I know that they will want to know sooner than later on whether they can do this just from a planning standpoint.
I can send Debbie the call-in number if you'd like to speak with her. I can include her on the conference call.
Yeah, or can she just stand and,
Well, no, she's
If
present
you-
online. She's not present in the room.
oh, is she online? Okay, I'm sorry.
Do you mind if I send her the call-in number?
Sure.
Okay. Debbie just sent a message and asked if she could come over to the room.
No, let's
Let's
do
just
it,
keep it staff.
like a
and-
conference call, please.
Okay, perfect. I'm sending her the details. There she is.
Teresa.
All right, thank you, Teresa.
Hi. Debbie Randolph.
All right, thanks, Debbie, for joining us.
All right, thank you guys.
Was there something that you wanted to talk to us about?
The main thing is, if you've been to the Christmas stroll, the biggest issue I know this year with COVID is we post the numbers so then people can win the script money from. Typically, business owners can, they like to, some of them put them in the back of the store so people go through the store, maybe shop. And what we will do is they will all be outside the stores, or we're hoping that they will create a float. The float could be like a regular float or a boat that they decorate or something that is outside their office, their store, and they put the number on that. The other idea is to have those floats do a parade down Broadway and then be parked in front of the stores or offices.
Okay.
There's a delay. I'm having trouble. I hope you guys can hear me.
Oh, yeah, we can hear you fine.
Okay. So that's the biggest difference that the chamber came up with. And as you know, most of the activity is outside anyhow. Masks are required or whatever the situation is at the time. We're still trying to work on something with Santa Claus, so we could use some direction on that.
Okay. So I think maybe the best thing to do is to maybe include some of that stuff in an email, send that to Sean, he'll send it out to us. And like you said, then we'll all comment on that and make suggestions or whatever from there. How does that sound?
Do you have the plan that I sent Sean Sunday?
I do.
Okay. So I think in a summary of it is in number 6 of what I just said. On that first page, I believe.
Debbie, how do people get their
I think that's all I
numbers?
have is number 5, and then it says outline of event.
Yeah.
Okay.
Debbie, how do people get their numbers? Is there a registration desk or something like that?
No, they buy, typically in the past, well, it's changed over the years. Used to get them free. Probably again this year, like they have done, the Chamber's done for a couple years, you buy your number. You buy a card with your number on it.
Okay, and you
And
do
buy
that
ahead of time.
ahead of time. Okay, thank you.
Hey, Nicole, I guess I'm listening in on the live stream, and I don't hear any of this coming through the audio.
So you're not able to
Is there a
hear.
way to take is there a way to take like one of like say one of the microphones and put on the close to the conference call?
Absolutely.
See if that picks it up.
Absolutely. All right. Try saying something now. Let's make sure you can hear it. All right. Try saying.
All right, that's working very good. Thank you.
All right. And the delay on YouTube is typical. So you're going to hear that. So maybe if you're not speaking, if it's possible to mute.
Yeah,
Okay.
yeah, it's muted. So. All right. Is there anything else we need to do for this plan then? At this point.
So I think we will just keep it moving forward, Debbie. Let's we'll have a few more conversations about this, and I have a few more questions about it just because I've never been here for it. So I'll get those to you, and we understand that you need to know whether you can do this. The sooner the better. So we'll get those coming to you. Okay.
That would be great. Give me a list of questions. We do have a planning meeting Monday early evening
Okay.
with the chamber group. So if we could, maybe you can get your questions to us, and then we could address them Monday afternoon at our meeting.
Great. Thank you.
Perfect.
All right, thank you.
Guys very much.
All right, Sean, are there any other plans that we need to address?
We don't have anything at this point. We may be getting something from the American Legion. I'm meeting with them this afternoon. It may not meet the requirements for us to have to review it. And it's for their surf and turf dinner that they normally have. So I'm meeting with them today to go through that. If they have their restaurant license, which they're getting close to being done with their remodel, we would just run it like it was a restaurant versus an event. And so that's what I'm going to meet with them about today. So.
Okay, all right, that sounds good. Anybody else have any other questions on plans before we move on? No. Okay. Let's go ahead and move on to old business. Public health officer. Is Doc on the phone?
No, I don't believe he is called in.
Okay. Teresa.
Hi, can you hear me?
Yes, we can.
Okay, good. I wasn't sure if I was muted. I'm on my cell phone. I don't think I really have any old business. Not that I can think of anyway.
Okay. I guess we'll cover what's going on currently in new business then, huh?
Yep.
Okay. Any other reports from Board of Health members? Okay. I guess if there aren't any, we'll move on to approval of the minutes for September 16th, 2020.
I'll make a motion to approve the minutes as circulated.
Okay. I will second. Any discussion? Okay, all those in favor signify by aye. Aye. Okay, thank you. Sean, old business.
I don't think I have any old business. I think most of our little stuff has been kind of tidied up, and we're just now having fun with COVID, so we'll be doing that later. Yeah.
Okay. Anybody else? Any other officers, old business? Okay, let's move on to new business. Doc's not there. Anything from the other Board of Health members? Okay, JJ Connor, you're with us, right?
Yes.
All right, thank you for attending. Any questions or anything from you?
Just thank you for allowing me on the board. I guess just as far as duties and such as alternate and non-voting, just kind of wondering what you will need from me.
Okay, very good. I think when we get an opportunity to talk face-to-face, we'll do that. But I know
Okay.
we're excited to have you and your expertise, and thank you for volunteering to join our board.
Thank you.
And I just want to say a quick word about
All right,
JJ,
Teresa,
if I
New
can.
business.
Well, Daryl, can I say something real quick?
Oh, yes, you can. I
Sorry.
can't hear you real well, Sean.
It says it's green light. I'm a little closer now. Can you hear me better now?
Okay, go ahead. Yeah.
So I was just going to say that JJ is a good addition to the board because he's has an environmental background, and that was what we were kind of missing in terms of for the board. So in terms of many the other things that I do for the county, like drain fields and that type of thing, JJ is going to be an important person to have on the board, or with us. So I'm very excited to have him here to also bounce off ideas and get some other input. So I just wanted to throw that out there real quick. So thank you.
All right, good. Yeah, thanks for that, Sean. Yeah, JJ's advisory experience is going to be very helpful for everyone.
Daryl Dwight here. Can I dovetail a question?
Yes, you sure can.
Daryl, Laura had talked about some board training. I think it was last month or so. Just kind of a little note. Is there any feedback or anything new on that?
Yes, yeah, we are going to have that board training. I think we're going to have to wait till things settle down here a little bit. I think if I remember right, that's going to be offered through MACO, and we need to get that set up. So when we get that set up, we'll provide that training for everybody, and I think that'll be very helpful. Yeah, thanks for reminding us of that. Thanks, Dwight.
Daryl, is that something you want me to pursue for you?
Well, that would be great. I mean, it takes a little bit of it off my plate. If you're willing to pursue that would be wonderful. And we can help you with getting to the right resource, too.
That sounds good. Helen and I will take that on.
Wonderful. Thank you so much. Anything else? Anybody? Okay. If not, then we'll move on to Teresa. Teresa, go ahead.
Okay, well, we are getting new cases at least twice a day. This morning at 9:30, I got 5 new cases of COVID. The hospital's doing quite a few. I don't know if Leota's on the call. I've heard all the people that I've talked to is 11 a day, 13 a day, 20 a day. so the hospital is really doing a lot of COVID tests. So I'm also getting a lot of complaints. So I think that's something that I'll probably need to visit with Sean about, but mainly two places, and that's Full Belly Deli and the grocery store. We are just getting inundated with calls on the grocery store not wearing masks and that kind of thing, and wanting to know why we're not doing anything about it. And basically my response is, we're doing everything we can, working overtime, trying to, work on the cases that we have. And so my response to people has mainly been, you have an option whether you go in or don't go in. So people have to take responsibility. But I think that we need to be in touch with the grocery store and remind them that it is the governor's, it is in the governor's order that everybody wear masks. And so I know it's hard to just grab people when they walk in the door and say, hey, you got to have a mask on. But I think that they need to try to be a little bit more responsible there. I don't know what else to say. It's just it's really, really going around right now, and it doesn't seem like it matters, who you talk to. Somebody in town's got it, so we're just doing the best we can, trying to keep up with the cases over here. I do have some new staff, so it's helping, but in spite of getting new staff, our cases obviously have doubled. So even with the new staff, it's very, very hard. So anyway, I was planning on having a nice presentation all worked up on age grouping and where we're seeing most of our cases coming from, and that all that stuff takes an intense amount of time and research. Not that I don't have it all here, it's just putting it all together for a presentation, and obviously I just didn't have time to do that. So hopefully now with the new staff, I'll be able to be able to get some of that done. We're also looking at flu season. We're doing tons and tons of flu shots, which is good. We have probably 20 a day at least, if not more. And we're kind of behind getting some of the home visits and stuff like that done. But I'm working 9 or 10 hours a day and weekends and just not able to keep up. So anyway, I guess that's about it. Just everybody be safe, wear a mask, stay home if you're sick, get your flu shot.
All right, thank you, Teresa. Well, thanks for everything you and your staff are doing. I know that you're overwhelmed, and I guess reach out to us if there's something that you think we can do for you.
Yeah, we'll do.
Okay, thank you. Sean, you're up.
Thank you. So I would like to just kind of reiterate what Teresa just said, is we're getting a lot of complaints about different facilities, and it is a lot of times the same facilities, but one of the issues that, and I brought this up last week to Corey, the county attorney, is it's one thing if a facility doesn't require the customers to put on masks. It's yet another issue if the facility itself does not use the masks. And what Corey told me is that from the previous, we've had these conversations. We had these in March when we first went through this. And the idea was for the clientele or the customers, we just had to work on education and try to get the community to fall into step with wearing the masks. As for the employees and the owners, I've been waiting for a response from him, because to me, if they're not going to do it, we're not going to see the the clientele or the patrons put them on for sure. And there are some tricky situations like the Full Belly Deli that there are some little loopholes that allow them to say that they can't work with the masks on, and without some sort of enforcement for me. If I can't enforce it, it doesn't matter what I tell them to do if there's no enforcement. So what I'm looking for from the county attorney's office is an ability to do enforcement at a minimum for the employees or the owners of these facilities. I just need to know how to do that, because if all I'm doing is going and educating, that's fine, but we will continue to get all the complaints about those facilities. And I was at the grocery store last week because there was a different complaint about some food issues. And when I was there, all of the employees had masks on, and actually everyone in the store had masks on. So it's obviously a hit and miss kind of thing. So I can continue to do some pop-in visits, but we can't police it 24/7 either. So.
This is Corey. I'm on.
Oh.
I'm on the call.
Okay.
Daryl, can I just address something real quick?
Yes, you sure can. Thank you, Corey.
So, I guess my view. Well, first of all, I would say part of the process for any enforcement, I think, is going to have to be to provide the information. Sean reached out to me last week. We talked about this a little bit, and I didn't realize that we're dealing with. Apparently, Sean and Teresa are getting lots of complaints. I mean, I've never actually received a complaint forwarded to me. Here's my recommendation, and I kind of talked about this a little bit with Sean. If it's a business that is enforcing it internally and asking their customers to wear the mask, and the customers either, if customers are great, if it's hit and miss, then I think that is a matter of simply both telling the organization, look, keep doing that, you're doing the right thing, and what can we do to help? I mean, I don't know that businesses are going to put like some kind of a blacklist on their door that says Bob Smith can't come in because he refuses to wear a mask or something. I have seen the town pump, for example, employees ask customers to leave or to when they walk in the door. Actually, I've seen that with RMS as well. People walked in the door and the employee has said, you have to wear a mask to be in here. And so I understand that you can't, I don't know if they can. If they can't have somebody sitting there policing the door. Certainly, I think I've seen fairly successful effort from the businesses in town to do that and to tell customers you have to wear a mask. I think if you're at a point where you've got a business, I think particularly a food handling business that's saying we're not going to comply, that's something that I would like that to come to me so I can have a more direct conversation with them. There are, and I view these as not first options, I view these as second or third or fourth option, but if you have a business that's regulated by health and sanitation codes, Sean, is there a catch-all that you have to follow the sanitation codes of the local Board of Health or the state Board of Health? I would think that we would be in that arena.
Yeah, I would imagine that you're right there as well. I don't have that in front of me.
But I would say the other thing is, I would like all complaints, just like any other complaint that we deal with, I would like it to come from, if it's Sean or Teresa or whoever receives it, I would like it to come to the sheriff's office and to me that way, because that's how we're going to actually track this stuff. And that's where I think if it's something that's just customers are not listening to employees have to ask them to leave. That's one thing. If it's a business that is repeatedly just saying, well, we're not going to do it, yeah, I think that's where I can get involved and have a more direct conversation.
Okay.
I guess
Hey,
I'll add one more thing.
Rob Sandberg, I have a question for Corey.
Go ahead.
Did the governor update the current directive? Is there a new directive? I guess that gives the original emergency order more teeth, because I had an attorney interpret for me and my business what it says, and there's nothing in the order in the regard as far as regards to if a non-food preparation business, as far as the participation goes, that says that you have to or else verbiage. It uses the word may and should, not you will or shall. And so I see the only directive that had to be done was that the order had to be posted on the door, and then to use the situation as an educational purpose. And if a store wanted to enforce 100% masks and ignore the list of exemptions, they have the authority to ask that person to leave under private property premise. But I really didn't see anything that is verbiage that said that it's mandatory that if somebody comes in without a mask, that the store owner or vice versa needs to challenge that person or shall challenge that person. And if that person is unable to comply due to an exemption or otherwise, that it's mandated that that person be turned around.
So that's basically, you hit on
that's
the...
correct. This is Teresa.
Someone was speaking, I couldn't hear. Mhm.
Is somebody trying to comment?
Teresa, I was just saying that I believe that is correct. But our Board of Health does have the option to, make that into what we want it to be too. Being that our community right now is going through such a high level of COVID. We have to do what the governor says we have to do, but we can also make the orders more stringent if we want, as a Board of Health. We have that power. But I do know, like in Helena, the businesses that don't have food, people can go in and just say, I have asthma, I can't wear a mask, and, they allow them to come into their business. So.
Right, because I mean, if the Board of Health is going to make a more stringent thing, then I see it necessary that each person that's exempt is going to have to carry some kind of card to prove that they're exempt, in order to enforce it. And who has the authority to ask, I guess, that question that's outside of law enforcement or a person such as myself that has, that works for public health and the Department of Defense. I just don't see it as enforceable as far as person to person, and it's just I just see it turning into a witch hunt.
Well, I know other counties have enforced it, and there has been citations. I'm on the incident command team for Lewis and Clark and Jefferson, and they both have done citations. So I know it's enforceable. I just didn't investigate it because number one, I don't have time, and that's not something that I can do. So.
Well, I just
So
think
Rob, was your question to me or to Teresa?
I guess to whomever it applies to.
Okay. I'll answer the law questions, and I'll leave Teresa to answer the health questions. So, under the governor's directive, it's an enforcement of a public health order. It's basically a director of DPHHS order that the governor did by executive order. Under that, the enforcement is, it's not ideal. It's part of why I criticized the process of how he did it. And at the time that this was first enacted, it was basically left as a, ask people nicely type of thing. Okay? The county has not, the local board of health has not actually enacted any current, unless I'm aware of, I'm not aware of either something you did today or something you did last week, because I didn't see the minutes from last week. As far as I'm aware, the county has not enacted a local board of health regulation that's more stringent than what the governor's done. And therefore, enforcement mechanisms were under Title 50, Chapter 1. Now, I don't think that's accurate that other counties have, the only counties that I'm aware of who have done any citations, because I just had a call with all of the county attorneys, with the exception of Missoula. So I'm not sure what Missoula's done. Fergus County did one citation, and it was a resolved out of court, and that was for an egregious issue that happened, and that was way back in March. Jefferson County's not done any criminal citations. If they've done anything, it's a basically like a notice to cease and desist. Lewis and Clark County did a restraining order as a civil matter to stop a farmer's market that was operating without a public health permit. And then they have a second one, and now they're looking at potentially something due to the big Freedom concert. So I'm not sure, Teresa, where you're getting your information, but all the county attorneys are basically in the same boat I am, which is this current directive right now. Yes, there's a way for us to do enforcement, but first line is going to not, there's not going to be legal citations like misdemeanors. Generally, there's going to be other things that we can do. I have a problem in general with this trespassing thing, the way this is done, because the trespassing ordinarily is a matter of the person, the business's permission that they're either giving or taking away. So if in my business, I ordinarily am not saying you're required to wear a mask, the governor is saying, business owner, you have to require them to wear a mask. Trespassing is one of those very few cases where the person has to actually press charges rather than the state, because it's a matter of what permission they've allowed to have on it. Bottom line is this. What I'm recommending we do is for egregious violations where you guys have talked to them and they're not going to comply, forward that to me and the sheriff's office. And we will, there's a variety of options we can take. We can do a restraining order, but that's going to be something that I'm going to have a direct face-to-face or mask-to-mask or whatever Zoom conversation with this person first before I do a surprise restraining order on it. If the local board of health wants to do something more stringent, the penalties under Title 50, Chapter 2 are more stringent than under Title 50, Chapter 1, which is the state.
So yes, I guess to continue that discussion, yeah, because and I've been away obviously for a month, so I just wanted to make sure that there wasn't anything new that had happened in the last month. But I reviewed the order a day or so ago, and right under business and this is getting back to the trespassing clause. I mean, it does not say that the business shall or must. It says may ask a person to leave. May is optional. Outside, what's not optional is that you have to put the order on places of entry, and then each person is asked to operate in good faith. That obviously, if somebody comes in with oxygen, to their nose, obviously you can clearly see that person is exempt. But it seems to be a good faith request on businesses to comply rather than we just have to be door Nazis and stand up and say, no, you and you and you, show me an exemption card or you're out of here, you know, or else, I guess. So it's just, you know, unfortunately, it's a very gray area in that documentation, and everybody's definition of reasonable is going to be different. And I just think it's just a little bit of a nightmare to try to enforce it legally, I guess.
Yeah, I agree. However, and there was also a press conference last week where the governor offered more encouragement for enforcement, as well as basically some funds will be dedicated to it. But there wasn't a change in the enforcement authority. So it's either going with the July 15th directive, unless there's a newer one out there that I'm not aware of, or if the local board wants to enact a more restrictive measure. I am brainstorming with how we could use additional funds to assist my office in doing enforcement. I mean, good luck trying to hire a temporary person right now that would be qualified to jump in and assist us. I'm looking at that, but I would urge Sean and Teresa that if you get someone that's beyond the oops, my innocent mistake level of non-compliance, you know, don't send those to us. But if it's somebody that is a persistent non-compliant, send that to me and I'll address him or her.
So this is Sean, and I would like to just point out that the face covering requirements that I have the directive right in front of me from July 15th, 2020, and it doesn't say may, it says shall require right under it. So I think we need to, I mean, if you want me to read the whole thing, I can, but I don't think it does say may. And it says, it does go on under the FAQs to talk about that it's not an option, it's for businesses to not enforce it. It says business owners must require masks and must enforce the directive, but the manner of enforcement, whether by denying entry, refusing service, or asking people to leave, is within their discretion. So I don't want, you know, it's something that maybe Corey and I, or just Corey, can kind of review again to, because I am not an attorney, but when I read that, I see the words require and must there.
Yeah, so on page 3, section 2, Sean's referring to, it says shall, except as provided in section 4, businesses, government offices, or other persons responsible for indoor spaces open to the public shall require and take reasonable measures, etc. Then there's a trigger provision later that it's for cases where there are active cases of 4 or more in a particular county. The area where it's less clear is then if you go to section 5, enforcement, which begins on the bottom of page 4 and goes forward. The enforcement provision is where it is less concrete. I suspect that's what Robbie's referring to.
Exactly right.
So it reminds you of that old movie, Fiddler on the Roof, right, where they're arguing and the one guy says something and the other guy, and the main character says, you're right. And then the other guy says something else and he says, you're right. And the third man says, he is right and he is right. They can't both be right. And he says, but you are also right.
I'm just reading here. If such a person refuses to wear a face covering and refuses to leave the premise, a peace officer may enforce, you know, again, it uses may again. But, no, I guess I don't know. It's just this directive is very subjective, I guess. And if I'm just simply raising the concern that if we're going to become serious about enforcing it, we need a clear directive, I guess, for people to follow. Is my point.
Okay. Thanks, Robbie.
That's the end of that.
Yeah.
Yeah.
And I think the reluctance here is that, you know, nobody wants to go throw a business owner in jail because they're trying to make a living and deal with, you know, the worst economy we've had in decades. So what I would urge, you know, I would continue to urge, and I have been doing this. You know, my office, we started this before we actually hit the trigger because I could just see it coming. But I would urge everyone to enforce masks, enforce sanitation, distancing, and, you know, sending employees home if they're sick, getting all those things that we're doing. I got a negative test back on myself today, about an hour ago, but I'm going to stay working from home for another week because that's what the quarantine requires, okay? We need to force ourselves to do the hard right thing on this. When it comes to enforcement, if we get people that are simply not doing it to where we think it's potentially affecting the public, please notify me and the sheriff's office, or that complaint to us, and we'll address it. If it's not that, it's just a one-time lapse or a, you know, isolated event, don't forward that to me because, you know, I've got 5 new felonies this week that I'm filing. It's like we got a lot going on right now, but I will certainly help where I can. But this thing is not set in stone. It's not crystal clear, and everyone across the entire state is grappling with this exact issue we're dealing with today.
All right, good. Thank you, Corey, for your guidance. And so I guess the message is for everybody, if we have complaints, we'll forward them through the sheriff's office to Corey. Okay?
Yep.
All right. Mike Delger, are you still on?
Yes.
Do you have anything for us?
No, just to reinforce what Corey says, everybody needs to wear a mask and sanitize, do your social distancing. Try to get through this mess.
Okay. Very good. Anything else from anybody before we adjourn? No? Okay, let's go ahead and adjourn. Thank you, everybody, for getting on for a conference call. I guess it's probably the safest and best way we could do it for right now. So thank you.
Thank you.
Is there a commission meeting after this, Daryl?
Yes, there is. Well, that's scheduled to start at 2 o'clock.
Do you want me to just call